For nearly 160,000 people in Indiana were on the line with today's ruling. Some in our state are breathing a sigh of relief tonight, while others are criticizing the decision from the nation's highest court. RTV 6 State House reporter Katie Hines is live with that part of our coverage. Katie?
Erica, the average tax credit here per person per month in Indiana is about $320 per person. But the nonprofit Kaiser Family Foundation estimates that premium would quadruple for the nearly 160,000 people who had subsidies if those subsidies were to go away. Thank you. Callie Sanders is a neighborhood advocate in Hawville. She works with single mothers and seniors through a pair of community organizations on a number of issues, including the options for paying for medical care.
Getting health care, getting their medications, being able to pay for this medicine.
She says the Supreme Court's decision to uphold subsidies under the Affordable Care Act is one less thing to worry about for the women she helps.
The problems are increasing.
IU McKinney School of Law professor David Orntlicker isn't surprised by the Supreme Court's decision. He says a ruling striking down the subsidies would have destroyed the health insurance exchanges in Indiana and 33 other states.
What the court said, we can't interpret the statute to make it fail, because if the subsidies aren't available in 2/3 of the country, the people won't be able to afford insurance, the exchanges will fail, and Congress surely would not have intended that result.
The nonprofit Kaiser Family Foundation finds the impact of a ruling striking down part of the Affordable Care Act would have stretched beyond the 160,000 people who receive subsidies. The organization says substantial premium increases would have been likely to make up for the people who would have dropped their coverage without a subsidy. But the law still remains controversial. Governor Mike Pence is one of many who disagree with the Supreme Court's decision. He says he's deeply disappointed in the ruling.
At the very core of Obamacare is an individual mandate and a business mandate that we had hoped would be overturned here, so that we could start over with the kind of health care reform that would be based upon individual choice and patient choice.
The National Federation of Independent Business is also speaking out against the ruling tonight, saying that they feel it fails both small business owners and its hardworking employees, despite making claims that it would make health insurance more affordable for everyone. But the Indiana Hospital Association tonight tells us that hospitals statewide are breathing a sigh of relief. Katie Hines, RTV 6.
Katie, thank you. More reaction. This from Indiana's representatives on Capitol Hill. Senator Dan Coates tells us he's deeply disappointed by the ruling.
I thought we had a real chance to get the court's support for changing this bill, which has been an immense mess. All that was promised by the president has been violated. People didn't get what they were told they were going to get. We wanted to have another crack at this and give people many more choices than they have, not have big government mandating, you got to have this, got to have that.
Democratic Congressman Andre Carson said today's decision is an extraordinary victory for our seniors, for Americans with pre-existing conditions, for young people with insurance coverage through their parents' plans, and for nearly 160,000 Hoosiers, including 20,000 in the 7th District, who can now keep their current health care. The Affordable Care Act is not about a political party. It is about progress for the American people.